WNWS-FM.com.
This is the Prime Time Drive. Dr. Jamie Koufman is internationally known. Someone that has worked extensively on reflux disease. Professor of clinical work at the New York Eye and Ear Infirmary of the New York Medical College. She has received many awards in career, and the book is called The Chronic Cough Enigma, The Path to a Cure. Doctor, it's good to have you with us.
Nice. It's nice to talk with you, Steve.
It's always a pleasure. Dr. Koufman was on with us a few weeks ago, and I had calls and emails wanting information about the book. And so the book is called The Chronic Cough Enigma, Acid Reflux, Asthma, Recalcitrant Cough, The Path to a Cure. And I just wasn't aware that as many people had trouble with this as they do, but apparently they do.
It's almost 1 out of 5 people. If you take chronic cough, which is more than 8 weeks, the chronic throat clearing people with, postnasal drip, that group, and then all the people with asthma, it's almost 20% of the nation.
Okay. Well, I guess that's why I had the response out there. It became obvious, Doctor, that people are looking for information about this. Some discontent, or at least maybe a feeling that something else is there or could be there for them.
Well, there's a lot of discontent. There's discontent that the purple pill isn't the only answer. There's discontent that people with cough and asthma don't have asthma, aren't getting better on asthma treatment. And there's general discontent with the healthcare system for people who don't know what's wrong with them. That's the problem. The specialist model only works if you know what's wrong. You got a bad, joint, you go to a joint doctor. You got a bad tooth, you go to a tooth doctor. But if you have postnasal drip or chronic cough and the lungs check out, or you have asthma and you're not getting better on treatment, then what do you do?
Okay, all right. And so that is, so some people, the condition persists and they just can't seem to find anybody to help them correct it then.
It turns out silent reflux is really a big deal. We made a big mistake, us doctors. In the 70s, when we started to think about reflux seriously, we said reflux was heartburn was reflux, and it was all about the esophagus. That's actually not true. Of my patients, only about 1 in 10 have heartburn at all. So that means it's other symptoms: hoarseness, postnasal drip, cough, a sensation of a lump in the throat, difficulty swallowing. All those kind of people come to me, and they have reflux, or the backflow of stomach contents up into the throat.
Okay. So they actually have reflux, it's just manifested in different ways?
Well, if you don't have heartburn,
right,
then it's called silent reflux.
Well, okay, and so it's a reflux, but it's a different type of reflux. It's not diagnosed often, so it's not treated then.
That's right. It gets people have sinusitis, don't have sinusitis. People have allergies, don't have allergies. People have asthma, don't have asthma. And so, if you ask me if I could only, share with your listeners one idea, it's this. People who have trouble with asthma have trouble breathing out, getting the air out during exhalation.
Okay.
But if you have trouble breathing air in during inspiration, during the getting air part of the breathing cycle, that's not asthma.
That's not asthma.
Reflux.
Okay. Oh, is that right? Okay.
Yeah.
All right, so calling it silent reflux denotes what? That it is not acid-based then?
It doesn't matter whether it's acid-based or not. It's just that a lot of people don't have symptoms of heartburn. Heartburn, you see people, they overeat. You see them, they catch on fire on TV and they clutch their chest.
Yeah, okay. Good commercials, yeah.
But you know what? It's quite different. What happens is Americans tend to eat too late. They come home, they're hard day at work, and then they went to the gym and had exercise, and now they're hungry and they're tired, and they eat a big meal, they lie on the sofa, they get up, they have dessert back on the sofa, and they reflux during the night.
Okay.
That's when the trouble occurs. Then they get up during the day in the morning, and they're hawking and coughing and clearing their throat and all of these things. Maybe they even wake up in the middle of the night unable to breathe, and it's confused as asthma, but it's really reflux.
Dr. Jamie Koufman is with us. Her work is expressed in The Chronic Cough Enigma, Acid Reflux, Asthma, Recalcitrant Cough, The Path to a Cure. Now, you were talking to me when we talked prior, for people who weren't here with us, that you got into this working with people that are in the entertainment business, that are singers, that are performers, that were coming to you, trying to figure out what was happening to them. It took you how long to start putting this together?
Well, I began working seriously with people about 10 years before I realized, I take care of singers and actors and a lot of singers. And for singers, of course, anything wrong with the voice is a nightmare and potential catastrophe. So I began seeing this same pattern of inflammation, and we began to do special testing looking for acid in the throat, and we were finding it. And so we began to think seriously about this idea of silent reflux. And it was because, indeed, reflux is the most common cause of hoarseness that I got into this.
Okay. Whoa. The reaction of other medical people, of other doctors to your conclusions has been what? I would think that initially there would be skepticism about this.
Well, there's been tremendous skepticism, but part of it is because, like I mentioned, this fragmentation. The GI doctors, they examine the esophagus only, and they don't have any tests for the throat. They don't examine the throat. The lung doctors, they don't examine the throat. They don't think about reflux. And the ENT doctors, they may be the best go-to person for throat reflux, but a lot of them aren't trained in this area yet. It's still relatively new, and I would say most of my colleagues are not very good at it. So that means that patients or people in general have to start educating themselves about reflux and silent reflux. And that's sort of why I wrote this book, to go around the medical profession.
Okay, just get straight to the point. What do I find, Doctor, when I read the Chronic Cough Enigma? The content of this book is what?
Well, you're going to find out basically that your story of going from doctor to doctor and getting certain kinds of treatments is familiar. You're going to find out that there's some kind of questionnaires that you can take out that'll help you make a presumptive diagnosis, and it'll give you information that you can take to your own doctor saying, hey, listen, this is an unusual idea. I read this book about my cough, and I think this is me. And that's what we're finding, that people are getting the book and then taking it to their doctors. Okay.
And their doctors say?
Well, half of them say, poppycock, and the other half of them say, wow, that's great.
Okay, well, but do be prepared. Somebody said, yeah, well, I've heard of that, Dr. Koufman, and that is poppycock. Okay.
I'll tell you what's interesting, though. I've gotten some really wonderful letters from doctors saying that they read the book and it changed how they practiced medicine. So
that's all right. Okay, so VoiceInstituteofNewYork.com. Can you get information on the book there at that website?
Get information on Voice Institute. You can get information on Amazon. It's Barnes & Noble's, by the way, has both the Chronic Cough Enigma and Dropping Acid. By the way, Dropping Acid is about reflux diet.
Reflux diet, cookbook, and cure. Yeah, add that in, Dropping Acid. And that book did very well.
It's a New York Times bestseller.
Yeah, and so it's out there. So the thing would be, and I guess, Doctor, we're going to see more of this type thing as we move more and more into healthcare and patient initiative out there. The patient's going to be looking for other options, because it's an exhausting thing if you got this condition and you can't seem to find anybody that can help you with it. And that applies, I would think, to other ailments that people have.
Well, there's good news, though. In my lifetime, I'm a baby boomer. In my lifetime, almost all these common diseases from diabetes and reflux and obesity and so on have skyrocketed. We're now aware, beginning to get a better idea of what is healthy diet and lifestyle.
Okay.
And my experience is people are willing to do it. If you tell them that they can get healthy again, they'll do it.
Okay. So there are things fundamentally we can do just to improve health overall if we'll just do those.
No question.
Okay, all right. The Chronic Cough Enigma, acid reflux, asthma, recalcitrant cough, the path to a cure, Dr. Jamie Koufman. And you can find out more at VoiceInstituteofNewYork.com. When are you going to retire, Doctor?
I'm not. It's funny because I'm down in North Carolina. I have children and grandchildren.
Okay.
I have a house down here, a little tiny house, and I see my children and grandchildren. But the reality is that I think the work that we're doing is important.
Okay.
I think that there are going to be educational programs directed at physicians to try to have a better understanding of these not very well understood problems.
Okay.
And that reflux is really the disease of our civilization. Right now, it's almost 50% Americans have reflux. That's a pretty big number.
Okay, so half of us do. Okay.
Almost.
Okay, and
pushing 50%.
So, hey, I guess it's good. It's good for some doctors, right?
Well, it's better for people to figure out how to take care of themselves. You do need to be checked by a doctor if you have this.
Right.
You do need to have the throat and the esophagus checked. But when push comes to shove, most people can heal themselves in this particular area.
Okay, all right. Doctor, it's always good to talk with you. I appreciate the call today and this chance to visit with you again, because I had a lot of reaction to that. People were inquisitive about the book, and I realized then, I thought, well, there are more people that are dealing with this than I had thought.
I'll come back anytime you want, talk whatever you want to talk about.
Well, great. We will do it. Enjoy those kids and grandkids.
Thank you.
Thank you very, very much. Dr. Jamie Koufman, the Chronic Cough Enigma, Acid Reflux, Asthma, and Recalcitrant Cough, the Path to a Cure. More information at voiceinstituteofnewyork.com. This is the Prime Time Drive.